Question 1. Quality control measures reveal a pattern of minor deviations in the sterile field maintenance protocol during several recent orthopedic procedures. These deviations include brief instances of non-sterile items being brought into close proximity to the sterile field, and occasional lapses in the scrub nurse's direct line of sight to the field. Which of the following approaches best addresses these findings within the operating room quality assurance framework? Option A. Document the deviations in the individual surgical team members' performance reviews, focusing on personal accountability for each instance. Option B. Classify the deviations as minor and inconsequential, given the absence of reported patient infections, and continue current practice without further investigation. Option C. Conduct a thorough review of the observed deviations against the established sterile field maintenance protocol, relevant AORN guidelines, and the Joint Commission standards to identify potential root causes and determine the need for targeted education or procedural adjustments. Option D. Immediately implement a mandatory, intensive retraining program for all surgical team members on sterile technique, assuming widespread noncompliance. The correct answer is C. Conduct a thorough review of the observed deviations against the established sterile field maintenance protocol, relevant AORN guidelines, and the Joint Commission standards to identify potential root causes and determine the need for targeted education or procedural adjustments. Explanation. Scenario analysis. This scenario presents a common challenge in operating room quality assurance, identifying and addressing deviations from established protocols that could impact patient safety and care quality. The difficulty lies in distinguishing between minor, inconsequential variations and systemic issues that require immediate intervention. Operating room nurses, as frontline caregivers, are crucial in this process, needing to apply critical thinking to interpret data, understand its implications, and initiate appropriate actions within the established regulatory framework. The pressure to maintain efficiency while ensuring absolute patient safety adds to the complexity. Correct approach analysis. The correct approach involves a systematic review of the identified deviations against established organizational policies, national nursing standards, and relevant accreditation guidelines. This approach prioritizes patient safety by ensuring that any identified issues are evaluated for their potential impact on patient outcomes. It aligns with the core principles of quality assurance, which mandate continuous monitoring, evaluation, and improvement of healthcare processes. Specifically, within the U.S. regulatory framework for healthcare, this would involve referencing standards set by organizations like the Joint Commission, which accredits and certifies healthcare organizations, and adhering to the practice standards outlined by professional nursing organizations, such as the Association of Perioperative Registered Nurses, AORN. The focus is on data-driven decision-making and evidence-based practice to identify root causes and implement corrective actions that prevent recurrence, thereby upholding the ethical and legal obligations of patient advocacy and safe practice. Incorrect approaches analysis. Dismissing the deviations as minor without thorough investigation fails to uphold the principle of proactive risk management. This approach ignores the potential for seemingly small issues to escalate or indicate underlying systemic problems, violating the ethical duty to provide safe patient care and potentially contravening regulatory requirements for incident reporting and root cause analysis. Implementing immediate drastic changes without a comprehensive understanding of the deviation's scope and impact is inefficient and can disrupt established, effective workflows. This reactive approach, rather than a systematic, data-driven one, may not address the true root cause and could lead to unintended negative consequences, failing to meet the standards of evidence-based practice and sound quality improvement methodologies. Focusing solely on individual performance without considering the broader system or environmental factors overlooks the complex interplay of elements that contribute to deviations. This can lead to unfair blame, demoralize staff, and fail to identify systemic issues that require organizational-level solutions, thus not fulfilling the comprehensive nature of quality assurance as mandated by regulatory bodies. Professional reasoning. Professionals should approach quality assurance data by first understanding the context and scope of the identified deviations. This involves comparing the findings against established benchmarks, policies, and best practices. A systematic process of data analysis, including root cause analysis when necessary, is essential to determine the significance of the deviations and their potential impact on patient safety. The decision-making process should be guided by a commitment to patient advocacy, adherence to professional ethical codes, and compliance with all applicable federal and state regulations governing healthcare quality and patient safety. This involves a collaborative approach, engaging relevant stakeholders to develop and implement effective, evidence-based interventions. Question 2. Market research demonstrates a growing availability of advanced surgical drapes with integrated antimicrobial properties and a wider range of specialized positioning devices designed for complex anatomical challenges. Considering the CNOR responsibility for patient safety and sterile field integrity, which of the following approaches best reflects current best practices in selecting and utilizing these materials? Option A. Primarily rely on the surgeon's stated preference for specific drapes and positioning devices, as their experience dictates the most effective and safest options for all patients. Option B. Select drapes and positioning devices based on a comprehensive assessment of the patient's specific anatomical needs, the surgical procedure's requirements, and evidence-based guidelines for infection prevention and pressure injury management, while also considering surgeon preference within these parameters. Option C. Utilize standard, universally applicable surgical drapes and basic positioning aids for all procedures to streamline inventory and minimize the need for specialized training, ensuring consistency in care. Option D. Prioritize the use of the most recently developed and technologically advanced drapes and positioning devices, assuming they inherently offer superior patient safety and sterility, regardless of specific procedural or patient factors. The correct answer is B. Select drapes and positioning devices based on a comprehensive assessment of the patient's specific anatomical needs, the surgical procedure's requirements, and evidence-based guidelines for infection prevention and pressure injury management, while also considering surgeon preference within these parameters. Explanation. This scenario is professionally challenging because the selection and application of surgical drapes and positioning devices directly impact patient safety, surgical site integrity, and the efficiency of the operating room. A nurse must balance the need for sterile field maintenance with patient comfort and the specific requirements of the surgical procedure. The choice of materials and devices is not merely a matter of preference, but is governed by established standards of care and regulatory guidelines aimed at preventing surgical site infections and ensuring optimal surgical outcomes. The correct approach represents best professional practice because it prioritizes patient safety and adherence to evidence-based guidelines. Utilizing drapes and positioning devices that are appropriate for the specific procedure, patient anatomy, and surgeon's technique minimizes risks such as pressure injuries, nerve damage, and contamination of the sterile field. This aligns with the fundamental ethical and professional responsibility of the certified nurse. Operating room CNOR, to provide safe and effective patient care, adhering to the principles of asepsis and patient advocacy as outlined by professional nursing organizations and healthcare regulations. Incorrect approaches fail to uphold these critical standards. Using generic or ill-fitting drapes can compromise the sterile field, increasing the risk of surgical site infection, a direct violation of infection control protocols. Employing positioning devices without considering patient-specific factors like skin integrity, existing medical conditions, or the duration of the surgery can lead to preventable complications such as pressure ulcers or nerve impingement, demonstrating a failure in patient assessment and advocacy. Relying solely on surgeon preference without considering established best practices or potential patient risks can also be problematic, as it may overlook critical safety considerations or newer, more effective technologies. The professional reasoning process for similar situations should involve a systematic assessment of the patient's needs, the surgical procedure's requirements, and available resources. This includes consulting relevant institutional policies, evidence-based practice guidelines, and engaging in clear communication with the surgical team. A CNOR should critically evaluate the properties of different drapes and positioning devices, considering factors like material permeability, absorbency, adhesive properties, and the biomechanical principles of positioning to ensure both sterility and patient well-being are maintained throughout the surgical process. Question 3. Compliance review shows that during a critical phase of a complex orthopedic surgery, a vital surgical instrument, a specialized bone saw, began to malfunction, exhibiting erratic power and inconsistent cutting ability. The scrub nurse immediately alerted the surgeon. What is the most appropriate immediate course of action for the surgical team? Option A. Inform the surgeon of the malfunction, but allow them to decide whether to proceed or halt the procedure based on their assessment of the immediate risk. Option B. Continue the surgery using the malfunctioning instrument, instructing the surgeon to proceed with extreme caution to minimize potential harm. Option C. Immediately halt the procedure and request a sterile, functional replacement instrument from the sterile processing department or a backup instrument from the supply room. Option D. Attempt to quickly adjust the instrument settings or perform a minor field repair to restore its functionality, as delaying the surgery could have negative patient outcomes. The correct answer is C. Immediately halt the procedure and request a sterile, functional replacement instrument from the sterile processing department or a backup instrument from the supply room. Explanation. Scenario analysis. This scenario presents a common challenge in the operating room, ensuring the availability and proper functioning of essential surgical instruments and equipment while adhering to strict infection control and patient safety protocols. The challenge lies in balancing the immediate needs of a surgical procedure with the long-term implications of instrument maintenance and regulatory compliance. A failure in any aspect can compromise patient outcomes, lead to legal repercussions, and damage the facility's reputation. Correct approach analysis. The correct approach prioritizes patient safety and regulatory adherence by immediately addressing the identified issue. This involves halting the procedure until a functional and sterile alternative is procured, and then initiating a thorough investigation into the cause of the malfunction. This aligns with the fundamental ethical and legal obligations of healthcare professionals to provide safe patient care and maintain a sterile environment. Specifically, it upholds standards related to infection prevention and control, as well as the duty to ensure that all medical devices used are in good working order and have been properly sterilized according to established protocols. This proactive stance prevents potential harm to the patient and ensures that systemic issues are identified and rectified, thereby preventing future occurrences. Incorrect approach is analysis. Continuing the procedure with a malfunctioning instrument poses a direct risk to patient safety. This could lead to delayed surgery, increased blood loss, tissue damage, or the need for additional interventions, all of which violate the principle of non-maleficence and the regulatory requirement for safe medical practice. Furthermore, using non-sterile or improperly functioning equipment breaches infection control standards, increasing the risk of surgical site infections, which are a reportable adverse event in many jurisdictions. Attempting to repair the instrument intraoperatively without proper sterile technique or validation of its functionality is also unacceptable. This introduces a significant risk of contamination and may not resolve the underlying issue, potentially exacerbating the problem or leading to further complications. It bypasses established protocols for instrument maintenance and sterilization, which are critical for preventing the transmission of pathogens. Ignoring the malfunction and proceeding with the surgery without addressing the issue is a severe breach of professional responsibility and regulatory compliance. This demonstrates a disregard for patient well-being and a failure to uphold the standards of care expected of operating room personnel. It directly contravenes guidelines on equipment integrity and patient safety and could result in severe disciplinary action and legal consequences. Professional reasoning. When faced with a malfunctioning surgical instrument during a procedure, the professional decision-making process should be guided by a hierarchy of patient safety, regulatory compliance, and ethical principles. The immediate priority is to prevent harm to the patient. This involves a clear and decisive action to halt the procedure if the instrument is critical and cannot be immediately replaced with a sterile, functional alternative. Following this, a systematic approach to identify the root cause of the malfunction is essential. This includes documenting the incident, reporting it through appropriate channels, and participating in quality improvement initiatives to prevent recurrence. Professionals must be empowered to speak up about safety concerns without fear of reprisal, and facilities must have robust systems in place for equipment management and incident reporting. Question 4. Process analysis reveals that a patient scheduled for a complex aortic valve replacement presents with a history of poorly controlled hypertension and a recent diagnosis of atrial fibrillation. The operating room nurse is preparing the sterile field and gathering necessary supplies. Which of the following actions best demonstrates adherence to regulatory frameworks and best practices for cardiovascular surgical nursing? Option A. prioritizing the immediate setup of the sterile field over reviewing the patient's complete medical history and understanding the nuances of their cardiovascular conditions. Option B, focusing exclusively on setting up the standard surgical instruments and drapes for the aortic valve replacement, assuming the anesthesia provider and surgeon will address any patient-specific concerns. Option C, waiting for the surgeon to explicitly request specific medications or equipment related to the patient's hypertension or atrial fibrillation before preparing them. Option D, proactively consulting with the anesthesia provider and surgeon regarding the patient's specific cardiovascular risks, potential for hemodynamic instability, and the need for specialized medications or monitoring equipment based on their medical history and the planned procedure. Correct answer is D. Proactively consulting with the anesthesia provider and surgeon regarding the patient's specific cardiovascular risks, potential for hemodynamic instability, and the need for specialized medications or monitoring equipment based on their medical history and the planned procedure. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of cardiovascular surgery and the potential for rapid patient deterioration. The operating room nurse must possess a comprehensive understanding of cardiac anatomy, physiology, and the specific surgical interventions being performed. Furthermore, adherence to established protocols and guidelines is paramount to ensure patient safety and optimal outcomes. The challenge lies in integrating theoretical knowledge with practical application in a high-stakes environment, where split-second decisions can have profound consequences. Correct approach analysis. The correct approach emphasizes the nurse's responsibility to anticipate potential complications by thoroughly reviewing the patient's medical history, understanding the planned surgical procedure, and identifying any specific risk factors. This proactive stance aligns with the fundamental principles of patient advocacy and the nursing process, which mandate comprehensive assessment and planning. Specifically, in the context of cardiovascular surgery, this includes understanding the implications of pre-existing conditions like hypertension or arrhythmias on anesthetic management and surgical technique. It also involves anticipating the need for specific equipment, medications, and potential interventions based on the anticipated surgical steps and the patient's unique physiological profile. This approach is directly supported by the Association of Perioperative Registered Nurses, AORN, Guidelines for Perioperative Practice, which stress the importance of preoperative assessment and planning to ensure a safe and effective surgical environment. Incorrect approach is analysis, an approach that focuses solely on the immediate surgical steps without considering the patient's overall cardiovascular status and potential complications, represents a significant regulatory and ethical failure. This reactive approach neglects the proactive assessment and planning required by professional nursing standards. It fails to uphold the ethical principle of beneficence by not adequately preparing for the patient's well-being throughout the entire perioperative period. Furthermore, it deviates from the AORN guidelines, which mandate a holistic approach to patient care, encompassing preoperative, intraoperative, and postoperative considerations. Another incorrect approach, which involves relying solely on the surgeon's directives without independent critical assessment, also constitutes a failure. While collaboration with the surgical team is essential, the perioperative nurse has a distinct professional responsibility to assess, plan, and intervene based on their own knowledge and judgment. Abdicating this responsibility can lead to missed critical signs or unaddressed patient needs, violating the ethical duty of care and potentially contravening professional practice standards that emphasize the nurse's role as an advocate and critical thinker. Professional reasoning. Professionals in the operating room should employ a systematic decision-making process that begins with a thorough preoperative assessment. This includes reviewing the patient's chart, understanding the surgical diagnosis and planned procedure, and identifying potential risks and complications. During the intraoperative phase, continuous patient monitoring, anticipation of the surgical team's needs, and prompt recognition of any deviations from the norm are crucial. This process is guided by established professional standards, such as the AORN guidelines and ethical principles, including patient advocacy, beneficence, and non-maleficence. Effective communication and collaboration with the entire surgical team are also integral to this decision-making framework. Question 5. The risk matrix shows a high probability of perioperative glycemic instability for a patient with poorly controlled type 2 diabetes mellitus scheduled for elective orthopedic surgery. The patient is currently on oral hypoglycemic agents and basal insulin. Which of the following nursing actions best addresses the identified risk according to current CNOR practice guidelines and U.S. regulatory frameworks? Option A. Administer the patient's usual morning dose of oral hypoglycemic agents and basal insulin prior to surgery, and monitor blood glucose levels every 4 hours intraoperatively. Option B. Collaborate with the patient's endocrinologist and anesthesiologist to develop a revised perioperative insulin regimen, including intravenous insulin infusion protocols and specific blood glucose targets, and ensure appropriate monitoring equipment is readily available. Option C. Postpone the surgery until the patient's hemoglobin A1C level is below 7%, relying on the patient's self-management of blood glucose with their current oral medications. Option D. Administer a standard dose of intravenous insulin, preoperatively based on the patient's weight, and continue a fixed infusion rate throughout the surgical procedure. Correct answer is A. Administer the patient's usual morning dose of oral hypoglycemic agents and basal insulin prior to surgery, and monitor blood glucose levels every 4 hours intraoperatively. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient with a complex endocrine disorder, specifically uncontrolled diabetes mellitus, undergoing elective surgery. The perioperative management of such patients requires meticulous attention to metabolic homeostasis to prevent acute complications like hypoglycemia, hyperglycemia, diabetic ketoacidosis (DKA), and hyperosmolar hyperglycemic state (HHS). Furthermore, the potential for delayed wound healing, increased infection risk, and cardiovascular complications in diabetic patients adds layers of complexity. The operating room nurse must integrate knowledge of endocrine physiology, pharmacological interventions for diabetes, and surgical risks to ensure patient safety. Correct approach analysis. The correct approach involves a comprehensive, multidisciplinary strategy that prioritizes glycemic control and addresses potential metabolic derangements. This aligns with established guidelines for perioperative diabetes management, such as those from the American Diabetes Association, ADA, and professional organizations like the Association of Perioperative Registered Nurses, AORN. These guidelines emphasize individualized patient assessment, preoperative optimization of blood glucose levels, intraoperative monitoring, and postoperative management. Specifically, the correct approach would involve consulting with the endocrinology team, reviewing the patient's current diabetes regimen, establishing clear glycemic targets for the perioperative period, and implementing a plan for insulin administration and glucose monitoring that accounts for the surgical procedure and anticipated NPO status. This proactive and collaborative approach minimizes the risk of perioperative complications and promotes optimal patient outcomes, directly reflecting the CNOR responsibility for patient safety and adherence to evidence-based practice. Incorrect approaches analysis. An incorrect approach would be to proceed with surgery without adequate preoperative glycemic assessment and optimization, assuming the patient's usual regimen will suffice. This disregards the significant metabolic impact of surgical stress, anesthesia, and NPO status on glucose regulation, potentially leading to dangerous hyperglycemia or hypoglycemia. Another incorrect approach would be to rely solely on the surgeon's or anesthesiologist's judgment, without actively involving the patient's endocrinologist or a diabetes educator, failing to leverage specialized expertise. This can result in suboptimal management plans that do not fully address the nuances of the patient's specific endocrine condition. A third incorrect approach would be to administer insulin based on a standardized protocol without considering the patient's individual response, current glucose levels, or the specific type and duration of the surgical procedure. This lack of personalization can lead to adverse events. Each of these incorrect approaches represents a failure to adhere to best practices in perioperative diabetes management, increasing patient risk and potentially violating standards of care. Professional reasoning. When managing a patient with a complex endocrine condition like uncontrolled diabetes undergoing surgery, the operating room nurse should employ a systematic decision-making process. This begins with a thorough preoperative assessment, including a review of the patient's medical history, current medications, and recent laboratory values, with a particular focus on glycemic control. Next, the nurse should identify potential perioperative risks associated with the endocrine disorder and the planned surgical procedure. Collaboration is paramount. Therefore, the nurse should proactively communicate with the surgeon, anesthesiologist, and relevant specialists, e.g., endocrinologist, to develop an individualized perioperative management plan. This plan should include specific targets for glucose monitoring and management, as well as contingency plan for managing unexpected metabolic derangements. Throughout the perioperative period, continuous monitoring and vigilant reassessment are crucial, allowing for timely adjustments to the management plan as needed. This approach ensures patient safety, promotes optimal outcomes, and upholds professional standards of care. Question 6. The efficiency study reveals a need to optimize the use of intraoperative neurological monitoring in complex spinal surgeries. Which of the following approaches best aligns with current CNOR, best practices, and regulatory expectations for ensuring patient safety while managing resources effectively? Option A. Rely solely on the surgeon's verbal confirmation of neurological integrity at the end of the procedure to justify the cessation of all intraoperative neuromonitoring. Option B. Implement a standardized protocol for continuous intraoperative neuromonitoring for all spinal surgeries, irrespective of the specific surgical approach, patient risk factors, or surgeon's assessment of necessity. Option C. Base the decision to initiate, modify, or discontinue specific intraoperative neuromonitoring modalities on a comprehensive preoperative assessment. The specific surgical procedures, inherent risks to neurological function, intraoperative findings, and consultation with the surgical and anesthesia teams, ensuring thorough documentation. Option D. Discontinue intraoperative neuromonitoring once the surgeon indicates that the immediate surgical field appears stable, regardless of the specific spinal segment or potential for delayed neurological compromise. The correct answer is D. Discontinue intraoperative neuromonitoring once the surgeon indicates that the immediate surgical field appears stable, regardless of the specific spinal segment or potential for delayed neurological compromise. Explanation. The efficiency study reveals a need to optimize the use of neurological monitoring during complex neurosurgical procedures. This scenario is professionally challenging because it requires balancing the imperative of patient safety, which necessitates robust monitoring, with the practicalities of resource allocation and potential for over-monitoring. The CNOR must possess a deep understanding of the indications for various neurological monitoring techniques, their associated risks and benefits, and the specific requirements dictated by regulatory bodies and professional standards of care. The correct approach represents best professional practice because it prioritizes patient outcomes by ensuring that neurological monitoring is utilized judiciously and effectively. This involves a thorough preoperative assessment, intraoperative vigilance, and a clear understanding of the surgical procedure's potential impact on neurological function. Adherence to established guidelines, such as those from the Association of Perioperative Registered Nurses, AORN, and relevant professional neurological societies, is paramount. This approach ensures that monitoring is not merely a routine, but a dynamic tool employed when indicated by the patient's condition and the surgical intervention, thereby minimizing risks of neurological compromise and optimizing the chances of a positive outcome. An incorrect approach that involves discontinuing intraoperative neuromonitoring solely based on a perceived lack of immediate change in readings, without considering the potential for delayed or subtle neurological deficits, represents a significant regulatory and ethical failure. This disregards the principle of do no harm and fails to uphold the standard of care expected of a CNOR. Such an action could lead to undetected neurological injury, resulting in adverse patient outcomes and potential legal ramifications. Another incorrect approach, such as implementing a blanket policy of continuous neuromonitoring for all neurosurgical cases regardless of complexity or specific risk factors, is also professionally unacceptable. This can lead to unnecessary resource utilization, potential for alarm fatigue among the surgical team, and may not be cost-effective, potentially diverting resources from other critical patient care needs. Furthermore, it may not align with evidence-based practice, which advocates for tailored monitoring based on individual patient and procedural risks. A third incorrect approach, failing to document the rationale for initiating or discontinuing specific neuromonitoring modalities is a failure in professional accountability and record keeping. Accurate and comprehensive documentation is a regulatory requirement and essential for continuity of care, peer review, and legal defense. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly assess the patient's preoperative neurological status and the planned surgical procedure's inherent risks to neurological function. Second, consult relevant evidence-based guidelines and institutional protocols for intraoperative neuromonitoring. Third, collaborate with the neurosurgeon and anesthesia provider to determine the most appropriate monitoring modalities and their indications. Fourth, continuously evaluate the patient's neurological status and the effectiveness of the monitoring throughout the procedure, making adjustments as necessary. Finally, ensure meticulous documentation of all monitoring activities, findings, and decisions made. Question 7. The audit findings indicate a breach in sterile technique occurred during a prolonged orthopedic procedure involving extensive soft tissue repair when a surgical instrument was inadvertently dropped onto the floor and then retrieved by a circulating nurse. The procedure was immediately resumed without further discussion or intervention regarding the dropped instrument. Which of the following actions best represents the appropriate nursing response in this situation? Option A. Document the incident in the patient's chart but proceed with the current instrument to avoid delaying the surgery. Option B. Attempt to quickly wipe down the dropped instrument with sterile saline before returning it to the sterile field. Option C. Continue the procedure as planned, assuming the instrument was not significantly contaminated and the risk to the patient is minimal. Option D. Immediately remove the contaminated instrument from the sterile field, decontaminate the operative site if necessary, and obtain a sterile replacement instrument. The correct answer is D. Immediately remove the contaminated instrument from the sterile field, decontaminate the operative site if necessary, and obtain a sterile replacement instrument. Explanation. Scenario analysis. This scenario presents a challenge in maintaining sterile technique during a prolonged surgical procedure involving a complex integumentary repair. The extended duration increases the risk of contamination, and the nature of the repair, e.g., grafts, complex closures, demands meticulous attention to detail to prevent infection and ensure optimal wound healing. The audit findings highlight a potential breakdown in adherence to established protocols, necessitating a critical evaluation of the nursing team's actions. Correct approach analysis. The correct approach involves immediate and thorough decontamination of the affected surgical instruments and the immediate operative field, followed by a comprehensive assessment of the wound and surrounding tissues for any signs of contamination or compromise. This aligns with the Association of Perioperative Registered Nurses, AORN, guidelines for perioperative practice, specifically those pertaining to sterile technique and environmental controls. AORN guidelines emphasize the importance of maintaining sterility throughout the procedure and the critical need to address any breaches promptly to prevent surgical site infections, SSI. Prompt decontamination and assessment are essential to mitigate the risk of introducing pathogens into the wound, which is a direct violation of patient safety standards and professional nursing responsibility. Incorrect approach is analysis. Continuing the procedure without addressing the potential contamination is a direct violation of sterile technique principles and patient safety standards. This failure to adhere to established protocols increases the risk of SSI, which is a serious complication that can lead to prolonged hospitalization, additional medical interventions, and increased healthcare costs. This approach disregards the fundamental ethical obligation to provide safe and effective patient care. Attempting to clean the contaminated instruments and field in situ without proper sterile supplies or protocols is also unacceptable. While the intention might be to salvage time, it compromises the sterility of the environment and the instruments, thereby increasing the risk of infection. This demonstrates a lack of understanding of proper decontamination and re-sterilization procedures, which are critical for preventing the transmission of microorganisms. Ignoring the incident and proceeding as if no breach occurred is a severe ethical and professional failure. It demonstrates a disregard for patient safety and a lack of accountability. Such an omission could lead to undetected contamination, resulting in an SSI that might be attributed to other factors, thereby delaying appropriate treatment and potentially harming the patient. This also undermines the principles of quality improvement and continuous monitoring of patient care. Professional reasoning. Professionals should employ a systematic approach to address breaches in sterile technique. This involves 1. Recognizing and acknowledging the breach immediately. 2. Halting the procedure if necessary to address the breach. 3. Implementing established protocols for decontamination, resterilisation, or replacement of contaminated items. 4. Thoroughly assessing the patient for any potential compromise. 5. Documenting the incident and the actions taken. 6. Participating in a debriefing to identify learning opportunities and prevent future occurrences. This decision-making process prioritizes patient safety, adherence to professional standards, and a commitment to continuous quality improvement. Question 8. Benchmark analysis indicates that a certified nurse, operating room CNOR, is circulating for total knee arthroplasty, TKA, utilizing a newly introduced implant system. The surgeon has requested the implant, but upon initial review, the nurse notes that the implant packaging appears slightly different from standard TKA implants, and the surgeon's preference card has not yet been updated for this specific system. What is the most appropriate course of action for the CNOR? Option A. Proceed with opening the implant as requested by the surgeon, assuming it is compatible with standard TKA instrumentation and protocols, given the surgeon's experience. Option B. Open the implant immediately and hand it to the surgeon, trusting their judgment regarding its suitability for the procedure. Option C. Inform the surgeon that the implant packaging looks different and suggest using a previously used familiar implant system to avoid potential complications. Option D. Confirm the correct implant size and type with the surgeon and surgical technologist. Verify the sterility and integrity of the implant packaging, and ensure any specific handling instructions for the new system are understood by the team before proceeding with its use. Correct answer is D. Confirm the correct implant size and type with the surgeon and surgical technologist, verify the sterility and integrity of the implant packaging, and ensure any specific handling instructions for the new system are understood by the team before proceeding with its use. Explanation. Scenario analysis. This scenario presents a common challenge in specialized operating rooms where the complexity of orthopedic procedures, particularly total knee arthroplasty, TKA, demands meticulous adherence to sterile technique and precise instrument handling. The introduction of a novel implant system introduces an element of the unknown, increasing the potential for error if established protocols are not rigorously applied or adapted. The nurse's responsibility extends beyond simple instrument counts to ensuring the integrity of the entire surgical field and the safety of the patient, especially when dealing with implants that may have specific handling requirements. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established sterile processing and surgical protocols, even when faced with a new implant. This involves confirming the availability and sterility of all required instruments and implants, verifying the implant's integrity and correct sizing based on surgeon preference cards and intraoperative assessment, and ensuring all team members are aware of any specific handling instructions for the new implant. This aligns with the fundamental principles of patient care and infection prevention mandated by regulatory bodies overseeing surgical nursing practice in the U.S., such as the Association of Perioperative Registered Nurses, AORN guidelines, which are foundational for CNOR certification. These guidelines emphasize the nurse's role in maintaining a sterile environment, preventing surgical site infections, and ensuring the availability of correct supplies and equipment. Incorrect approaches analysis. One incorrect approach involves proceeding with the surgery without confirming the specific implant size. This poses a significant risk of intraoperative complications, including malalignment, instability, or the need for revision surgery, directly violating the ethical obligation to provide competent and safe patient care. It also fails to meet the standard of care expected in orthopedic surgery, where precise implant selection is critical. Another incorrect approach is to assume the new implant system is interchangeable with older models without explicit verification. This assumption can lead to using incorrect instruments or techniques, potentially damaging the implant or compromising the surgical outcome. This demonstrates a failure to exercise due diligence and a disregard for the specific requirements of new technology, which is contrary to the principles of continuous learning and adaptation expected of certified perioperative nurses. A third incorrect approach is to delegate the responsibility of verifying implant integrity and compatibility solely to the surgical technologist without direct nursing oversight. While the surgical technologist plays a vital role, the registered nurse holds ultimate accountability for patient safety and the overall management of the surgical field. This abdication of responsibility is a breach of professional duty and can lead to critical oversights. Professional reasoning. Perioperative nurses must employ a systematic approach to patient care, particularly in specialized procedures. This involves proactive assessment, clear communication, and vigilant monitoring. When introducing new implants or techniques, the decision-making process should involve 1. Thorough preoperative preparation, including reviewing surgeon preference cards and implant information. 2. Intraoperative vigilance, ensuring all supplies are present, sterile, and correctly identified. 3. Effective communication with the surgical team regarding any deviations or concerns. And 4. A commitment to patient safety above all else, which may necessitate pausing or delaying the procedure if critical safety elements are not met. Question 9. The control framework reveals that during a laparoscopic cholecystectomy, the surgeon is meticulously dissecting the cystic duct and artery. The nurse, observing the surgical field and recalling the standard procedure, anticipates that the next critical step will involve ligating and dividing these structures. Considering the potential for minor bleeding or unexpected anatomical variations, what is the most appropriate action for the CNOR to take at this juncture to ensure optimal patient safety and procedural efficiency? Option A. Ask the surgeon if they require any specific instruments, deferring the decision-making entirely to their immediate verbal request. Option B. Begin to clear the surgical field of any non-essential instruments, focusing on maintaining a tidy workspace rather than anticipating immediate procedural needs. Option C. Proceed with preparing the suction apparatus for immediate use, assuming that bleeding is imminent and will require rapid suctioning. Option D. Ensure that appropriate ligating clips and fine-tipped scissors are readily accessible and within the surgeon's immediate reach, anticipating the need for precise division of the cystic duct and artery. The correct answer is D. Ensure that appropriate ligating clips and fine-tipped scissors are readily accessible and within the surgeon's immediate reach, anticipating the need for precise division of the cystic duct and artery. Explanation. The control framework reveals a critical juncture in the perioperative care of a patient undergoing a general surgical procedure. The challenge lies in the nurse's responsibility to anticipate potential complications and ensure the patient's safety and optimal outcomes, even when the surgeon's immediate actions might appear routine. This requires a deep understanding of surgical techniques, potential anatomical variations, and the physiological responses of the patient. The nurse must act as a vigilant advocate, integrating knowledge of the procedure with real-time assessment of the patient's condition and the surgical field. The correct approach represents best professional practice by prioritizing patient safety through proactive risk identification and mitigation. It aligns with the fundamental ethical and professional obligations of a certified nurse, operating room CNOR, to provide competent and compassionate care. Specifically, it reflects the CNOR role in anticipating potential complications, ensuring appropriate instrumentation and supplies are readily available, and communicating effectively with the surgical team. This proactive stance minimizes the likelihood of adverse events and supports the surgeon in executing the procedure efficiently and safely. Adherence to established protocols and a thorough understanding of the surgical procedure's potential pitfalls are paramount. An incorrect approach that focuses solely on the surgeon's immediate instructions without considering the broader procedural context or potential risks represents a failure in professional judgment and a deviation from best practices. This could lead to delays in care, increased patient morbidity, or even mortality. Such an approach may also violate regulatory guidelines that mandate nurses to actively participate in patient safety and risk management within the operating room. Another incorrect approach that neglects to anticipate the need for specialized equipment or anticipates complications based on incomplete information demonstrates a lack of comprehensive understanding of the surgical procedure and its potential variations. This can result in critical delays during the procedure, forcing the surgical team to adapt without necessary resources, thereby compromising patient safety and potentially leading to adverse outcomes. This oversight could be interpreted as a failure to uphold the standards of care expected of a CNOR. A further incorrect approach that involves making assumptions about the patient's anatomy or the surgeon's intent without direct confirmation is professionally unacceptable. This can lead to critical errors in instrument selection or procedural steps, directly endangering the patient. Professional decision-making in the operating room requires clear communication, meticulous attention to detail, and a commitment to verifying information rather than relying on assumptions, especially when patient well-being is at stake. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough preoperative assessment and understanding of the patient's medical history and the planned procedure. 2. Anticipation of potential complications based on the specific surgical procedure, patient factors, and common surgical risks. 3. Proactive preparation of necessary equipment, supplies, and medications. 4. Continuous monitoring of the patient's physiological status and the surgical field. 5. Clear and concise communication with the surgeon and other members of the surgical team. 6. Vigilant observation for any deviations from the expected course of the procedure. 7. Prompt and appropriate intervention when necessary, in collaboration with the surgical team. Question 10. Compliance review shows a surgical technologist inadvertently touched the sterile drape with the tip of an endoscopic grasper during a laparoscopic cholecystectomy, just prior to its insertion into the patient. The circulating nurse observed this action. What is the most appropriate immediate action for the circulating nurse to take? Option A. Immediately remove the contaminated grasper from the sterile field and replace it with a sterile instrument, while discreetly informing the surgeon of the breach. Option B. Continue with the procedure as planned, as the contamination was minor and unlikely to cause harm. Option C. Alert the entire surgical team to the breach and pause the procedure to allow for a full assessment of the sterile field integrity. Option D. Instruct the surgical technologist to quickly wipe the tip of the grasper with an antiseptic wipe before handing it to the surgeon. The correct answer is A. Immediately remove the contaminated grasper from the sterile field and replace it with a sterile instrument, while discreetly informing the surgeon of the breach. Explanation. This scenario presents a professional challenge due to the critical nature of maintaining sterile technique during endoscopic procedures. The introduction of a non-sterile item into the sterile field can lead to patient infection, a direct violation of patient safety standards, and potentially regulatory requirements for infection control. The nurse must make an immediate, informed decision that prioritizes patient well-being and adherence to established protocols. The correct approach represents best professional practice because it directly addresses the breach in sterile technique in a manner that minimizes patient risk, promptly removing the contaminated instrument and replacing it with a sterile one, while also informing the surgeon, ensures that the procedure can continue safely without compromising the patient's health. This aligns with the fundamental ethical principle of non-maleficence, do no harm, and the regulatory expectation for sterile processing and handling of surgical instruments. An incorrect approach involving continuing the procedure without addressing the contamination would be a significant regulatory and ethical failure. It demonstrates a disregard for sterile principles, increasing the risk of surgical site infection, which is a reportable adverse event in many healthcare settings. Another incorrect approach, such as attempting to re-sterilize the instrument intraoperatively, is also unacceptable. This is often not feasible, time-consuming, and may not guarantee complete sterilization, thereby still posing a risk to the patient. Furthermore, it bypasses established protocols for instrument reprocessing. Ignoring the contamination altogether or delaying action would also be a failure to uphold professional responsibility and patient advocacy. The professional decision-making process in such situations should involve a rapid assessment of the breach, immediate implementation of corrective actions to restore the sterile field, clear and concise communication with the surgical team, and thorough documentation of the event and the actions taken. This systematic approach ensures patient safety, maintains accountability, and supports continuous quality improvement within the operating room. Question 11. The monitoring system demonstrates a sudden drop in blood pressure and a corresponding increase in heart rate during a laparoscopic cholecystectomy. Considering the typical anatomical relationships within the upper right quadrant of the abdomen, which of the following anatomical structures is most likely being compromised or irritated, leading to this physiological response? Option A. The hepatic artery, due to inadvertent injury during the dissection of the cystic duct. Option B. the phrenic nerve, due to its proximity to the diaphragm and potential irritation from insufflation or manipulation of the liver. Option C, the common bile duct, due to accidental transection or ligation during the procedure. Option D, the inferior vena cava, due to direct trauma or compression during dissection of the gallbladder bed. The correct answer is B, the phrenic nerve, due to its proximity to the diaphragm and potential irritation from insufflation or manipulation of the liver. Explanation: this scenario presents a professional challenge due to the critical need for accurate anatomical knowledge in a dynamic surgical environment. The operating room nurse must interpret real-time physiological data in the context of the specific surgical procedure and the patient's underlying anatomy. Misinterpreting anatomical landmarks or their relationship to vital structures can lead to incorrect interventions, patient harm, and potential legal or ethical repercussions. The CNOR certification emphasizes advanced knowledge and skills, including a comprehensive understanding of surgical anatomy, to ensure patient safety and optimal surgical outcomes. The correct approach represents best professional practice because it directly links the observed physiological changes to the specific anatomical structures being manipulated or at risk during the procedure. This demonstrates a deep understanding of surgical anatomy and its implications for patient care, aligning with the core competencies expected of a CNOR. It prioritizes patient safety by enabling timely and appropriate interventions based on a sound anatomical foundation, which is a fundamental ethical and professional obligation. An incorrect approach that focuses solely on the immediate physiological reading without considering the anatomical context fails to acknowledge the interconnectedness of anatomy, physiology, and surgical intervention. This oversight can lead to misdiagnosis of the cause of the physiological change and inappropriate management, potentially exacerbating the patient's condition. Ethically, this represents a failure to provide competent care, as it lacks the depth of understanding required to anticipate and respond to surgical complications effectively. Legally, it could be construed as negligence if patient harm results from a lack of anatomical awareness. Another incorrect approach that relies on generalized anatomical knowledge without specific reference to the operative site is insufficient. While general anatomical knowledge is a prerequisite, surgical procedures often involve specific anatomical variations or involve structures in close proximity that require precise identification and understanding. Failing to apply this specific knowledge to the immediate surgical field can lead to critical errors in judgment. This is a failure to meet the standard of care expected of a specialized surgical nurse. The professional reasoning process in such a situation involves a systematic approach. First, identify the observed physiological change. Second, recall and apply knowledge of the specific anatomy of the operative site and surrounding structures. Third, correlate the physiological change with potential anatomical disruptions or risks associated with the surgical manipulation. And fourth, formulate and implement an appropriate intervention based on this comprehensive understanding. This iterative process ensures that clinical decisions are grounded in accurate anatomical knowledge and patient-specific factors. Question 12. Cost-benefit analysis shows that while open surgery might have lower upfront equipment costs, laparoscopic surgery often results in reduced patient recovery time and fewer complications. Considering a patient with a condition where both approaches are technically feasible, what is the most appropriate course of action for the operating room nurse to support in terms of surgical approach selection? Option A. Defer the decision entirely to the surgeon without offering any input or consideration of the patient's potential recovery benefits. Option B. Recommend the open surgical approach due to its lower initial equipment investment and established familiarity for the surgical team. Option C. Advocate for the laparoscopic approach, provided it is clinically appropriate for the patient's condition and the surgical team is proficient. Option D. Suggest a hybrid approach that combines elements of both open and laparoscopic techniques, regardless of specific patient indications. The correct answer is C. Advocate for the laparoscopic approach, provided it is clinically appropriate for the patient's condition and the surgical team is proficient. Explanation: scenario analysis. This scenario is professionally challenging because it requires the operating room nurse to balance the immediate benefits of a minimally invasive approach with potential long-term patient outcomes and resource allocation. The decision-making process must consider not only the patient's immediate surgical needs, but also the broader implications for patient recovery, potential complications, and the efficient use of operating room resources, all within the established standards of care for Certified Nurse Operating Room (CNOR) professionals. Correct approach analysis. Prioritizing the laparoscopic approach when clinically indicated and supported by evidence-based practice represents best professional practice. This aligns with the CNOR commitment to patient safety and optimal outcomes. Laparoscopic surgery often leads to reduced postoperative pain, shorter hospital stays, faster return to normal activities, and decreased risk of infection, all of which contribute to improved patient well-being and potentially lower overall healthcare costs. Adherence to established protocols and surgeon preference for appropriate cases ensures that the chosen method is the most beneficial for the patient. Incorrect approaches analysis. Opting for an open approach solely due to familiarity or perceived ease of execution, without a clear clinical contraindication for laparoscopy, would be a failure to adhere to evidence-based practice and potentially compromise patient outcomes. This could be seen as a deviation from the professional standard of care, which emphasizes utilizing the least invasive effective method. Choosing laparoscopy without adequate surgeon training or necessary equipment, or when a patient's specific condition contraindicates it, would also be a significant ethical and professional failure, directly jeopardizing patient safety and potentially leading to adverse events. Professional reasoning. Operating room nurses must engage in a continuous process of critical evaluation. This involves understanding the patient's specific condition, the surgeon's expertise and preferences, the availability of appropriate technology and resources, and the latest evidence-based guidelines for surgical procedures. When faced with a choice between open and laparoscopic surgery, the professional decision-making process should involve a collaborative assessment of which approach offers the greatest benefit with the least harm, considering all aspects of patient care from preoperative preparation through postoperative recovery. Question 13. Comparative studies suggest that the precise identification and application of surgical instruments are critical for successful surgical outcomes. In a complex laparoscopic cholecystectomy, a nurse is presented with two similar-looking grasping instruments. One is a fine-tipped atraumatic grasper designed for delicate tissue manipulation, while the other is a more robust toothed grasper intended for firmer tissue engagement. The surgeon requests a grasper without further specification. Which of the following actions best demonstrates adherence to best practices in operating room nursing? Option A. Present both instruments to the surgeon, verbally identifying their specific types and intended uses, and await their explicit selection. Option B. Choose the tooth grasper, assuming it is more versatile and suitable for a wider range of tissue handling during the procedure. Option C. Select the instrument that visually appears to be the most commonly used grasper for this type of procedure based on general experience. Option D. Retrieve the instrument that was used in the previous laparoscopic cholecystectomy performed in the operating room, assuming surgeon preferences remain consistent. Correct answer is C. Select the instrument that visually appears to be the most commonly used grasper for this type of procedure based on general experience. Explanation. The scenario presents a common challenge in the operating room. Ensuring the correct surgical instrument is selected and utilized for a specific surgical step. This requires not only knowledge of instrument types, but also an understanding of their precise application within a procedure. Misidentification or misuse can lead to procedural delays, patient harm, and potential breaches of patient safety protocols, which are paramount in CNOR practice. The challenge lies in the nuanced differences between instruments that may appear similar but have distinct functions, demanding meticulous attention to detail and adherence to established surgical counts and instrument identification procedures. The correct approach emphasizes a systematic and evidence-based method for instrument identification and selection. This aligns with the core principles of patient safety and quality care mandated by regulatory bodies governing nursing practice, including those that inform CNOR certification. Best professional practice dictates that nurses rely on established protocols, surgeon preference cards, and direct verification to ensure the correct instrument is available and used appropriately. This minimizes the risk of error and upholds the standard of care expected of a certified operating room nurse. Incorrect approaches fail to meet these professional standards. Relying solely on visual similarity without confirming the specific function or surgeon's preference introduces a significant risk of error. This can lead to the use of an instrument that is not sterile, not the correct size, or not designed for the intended surgical action, potentially causing tissue damage or compromising the surgical field. Ethically, this constitutes a failure to provide competent care and a breach of the nurse's duty to protect the patient. Regulatory failures would include non-compliance with facility policies on instrument handling and surgical counts, as well as a potential violation of standards of practice that require nurses to be knowledgeable about the equipment used in patient care. Professional decision-making in such situations should involve a multi-step process. First, consulting the surgeon's preference card or established procedural checklist. Second, visually inspecting the instrument for any damage or contamination. Third, confirming the instrument's identity and intended use with the circulating nurse or scrub nurse. And finally, if any doubt exists, seeking immediate clarification from the surgeon or a senior nursing colleague before proceeding. This systematic approach prioritizes patient safety and ensures adherence to all relevant professional and regulatory guidelines. Question 14. Stakeholder feedback indicates a surgeon frequently requests modifications to standard sterile draping procedures for a specific type of abdominal surgery, often citing personal preference for improved surgical access. As a CNOR, how should you respond to a request to deviate from the established sterile draping protocol to accommodate this preference, ensuring patient safety and regulatory compliance? Option A. Document the surgeon's request and proceed with the standard draping protocol without further discussion, assuming the surgeon will adapt. Option B. Suggest that the surgeon consult with a colleague to validate their preferred draping technique before any modifications are considered. Option C. Immediately comply with the surgeon's request to modify the draping to facilitate their preferred surgical access, assuming their expertise supersedes standard protocols. Option D. Politely but firmly insist on adhering to the established sterile draping protocol, referencing AORN guidelines and institutional policy, and offer to discuss alternative approaches that maintain sterility and surgical access if the surgeon believes the standard method is inadequate. The correct answer is D. Politely but firmly insist on adhering to the established sterile draping protocol, referencing AORN guidelines and institutional policy, and offer to discuss alternative approaches that maintain sterility and surgical access if the surgeon believes the standard method is inadequate. Explanation. This scenario presents a professional challenge due to the need to balance patient safety, surgical efficacy, and the surgeon's preference, all within the established regulatory framework for operating room nursing. The CNOR role is to advocate for the patient and ensure adherence to best practices and established protocols, which may sometimes conflict with individual surgeon preferences. Careful judgment is required to navigate these situations, prioritizing patient well-being and evidence-based practice. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established institutional policies and evidence-based guidelines for surgical site preparation and draping. The Association of Perioperative Registered Nurses, AORN guidelines, which are foundational for CNOR practice in the U.S., emphasize sterile technique and the prevention of surgical site infections, SSI. These guidelines provide specific recommendations on draping procedures to create and maintain a sterile field, which is paramount for preventing microbial contamination. Adhering to these guidelines ensures that the surgical team is operating within a safe and controlled environment, minimizing patient risk. An incorrect approach that involves the surgeon unilaterally deciding to alter the standard draping procedure without a clear, documented rationale based on patient anatomy or a specific surgical necessity, and without consulting with the nursing staff regarding potential breaches in sterility, represents a significant regulatory and ethical failure. This failure violates the fundamental principles of sterile technique, as outlined by AORN guidelines, and potentially compromises patient safety by increasing the risk of SSI. It also undermines the collaborative nature of the surgical team and the nurse's responsibility to advocate for patient safety. Furthermore, bypassing established protocols without proper justification can be seen as a disregard for institutional policies and professional standards of care. Another incorrect approach, where the nurse passively allows the surgeon to proceed with a non-standard draping technique without questioning or seeking clarification, is also professionally unacceptable. This inaction fails to uphold the CNOR ethical obligation to patient advocacy and the professional responsibility to ensure adherence to safety protocols. It demonstrates a lack of assertiveness in a critical patient safety situation and a failure to engage in the professional reasoning process, which involves critical thinking, assessment, and communication to ensure the best possible patient outcome. The professional decision-making process for similar situations should involve a systematic approach. First, assess the situation and identify any deviations from standard practice or potential safety concerns. Second, consult relevant guidelines and institutional policies, e.g., AORN guidelines, hospital protocols. Third, communicate concerns clearly and respectfully to the surgeon, explaining the rationale based on patient safety and established best practices. If the surgeon insists on a deviation, the nurse should document the discussion and the rationale provided, and if patient safety remains compromised, escalate the concern through appropriate channels within the healthcare facility. This process emphasizes critical thinking, evidence-based practice, and effective communication to ensure patient safety and uphold professional standards. Question 15. To address the challenge of ensuring optimal patient safety and procedural efficiency in a busy operating room, particularly when faced with both scheduled and emergent cases, what is the most effective strategy for operating room setup and organization? Option A. Implement a standardized, multi-stage setup process that includes preoperative case review, meticulous sterile field organization, and a flexible system for readily accessing emergent supplies, all while strictly adhering to infection control protocols and AORN guidelines. Option B. Rely on the surgical team to identify and retrieve any missing instruments or supplies during the procedure, assuming they will communicate needs effectively as they arise. Option C. Stock the operating room with an exhaustive array of every conceivable instrument and supply to preemptively address any potential surgical need, regardless of the scheduled procedure. Option D. Gather instruments and supplies only as they are requested by the surgical team during the procedure to minimize perceived clutter and maximize immediate availability. The correct answer is A. Implement a standardized, multi-stage setup process that includes preoperative case review, meticulous sterile field organization, and a flexible system for readily accessing emergent supplies, all while strictly adhering to infection control protocols and AORN guidelines. Explanation. Scenario analysis. This scenario presents a common challenge in operating room, or management, ensuring efficient and safe patient care amidst resource limitations and evolving surgical needs. The core difficulty lies in balancing the immediate demands of scheduled procedures with the unpredictable nature of emergent cases, all while adhering to strict infection control protocols and maintaining optimal equipment availability. The nurse manager must exercise sound judgment to prevent delays, minimize risks of contamination, and ensure all necessary supplies and equipment are readily accessible without compromising sterility or creating unnecessary waste. Correct approach analysis. The optimal approach involves a proactive and systematic method for or setup and organization that prioritizes patient safety and procedural efficiency. This includes a thorough preoperative assessment of each case's specific requirements, ensuring all instruments, implants, and disposables are accounted for and sterilely prepared. It also necessitates a flexible organizational strategy that allows for rapid adaptation to emergent situations, such as having readily available stat packs or designated areas for quick retrieval of commonly needed items. Adherence to established protocols for sterile field maintenance, instrument counts, and environmental cleaning are paramount, directly aligning with the Association of Perioperative Registered Nurses, AORN, guidelines for perioperative practice, which are foundational for CNOR certification. These guidelines emphasize a systems approach to safety, including proper room turnover, equipment management, and sterile processing, all contributing to a safe patient environment. Incorrect approaches analysis. One incorrect approach involves a reactive setup, where instruments and supplies are only gathered as needed during the procedure. This significantly increases the risk of delays, potential breaches in sterile technique as items are rushed into the sterile field, and a higher likelihood of missing critical equipment or supplies, all of which violate fundamental patient safety principles and AORN guidelines regarding sterile field integrity and procedural preparedness. Another incorrect approach is to overstock the room with excessive supplies and equipment, anticipating every possible scenario. While seemingly thorough, This can lead to clutter, increased risk of contamination from unnecessary items, difficulty in locating needed items, and significant waste of sterile supplies. This approach is inefficient and can compromise the sterile field, contrary to AORN recommendations for organized and efficient sterile environments. A third incorrect approach is to neglect the importance of preoperative equipment checks and sterilization verification for all instruments, including those for emergent cases. This directly jeopardizes patient safety by introducing the risk of using non-sterile or malfunctioning equipment, a critical failure in adhering to infection control standards and AORN guidelines for instrument processing and patient safety. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the patient's surgical needs and the specific procedure. This involves consulting surgical preference cards, reviewing patient charts for any special requirements, and communicating with the surgical team. The next step is to systematically organize the OR environment, ensuring all necessary sterile instruments, implants, and supplies are present, correctly arranged, and within easy reach, while maintaining the integrity of the sterile field. This proactive organization should also incorporate contingency planning for emergent situations. Regular environmental checks and adherence to established protocols for room turnover and equipment sterilization are ongoing responsibilities. This systematic and proactive approach, grounded in evidence-based practice and regulatory guidelines, is essential for delivering safe and effective perioperative care. Question 16. Cost-benefit analysis shows that implementing a full, validated sterilization cycle for a specific instrument set requires additional staff time and resources, potentially delaying a scheduled elective surgery. The operating room nurse is aware of a slightly abbreviated, but still functional sterilization cycle that has been used in the past during emergencies. What is the most appropriate course of action to ensure patient safety and regulatory compliance? Option A. Utilize the abbreviated sterilization cycle, assuming it has been effective in the past and will save time, thereby avoiding a surgical delay. Option B. Rely solely on a thorough visual inspection of the instruments after a brief cleaning cycle, believing that any visible contamination has been removed. Option C. Adhere strictly to the full, validated sterilization cycle as per AORN guidelines, communicating the potential delay to the surgical team and exploring options for managing the schedule. Option D. Proceed with the surgery using instruments that have undergone a partial sterilization process, with a note to the surgeon about the shortened cycle. The correct answer is C. Adhere strictly to the full, validated sterilization cycle as per AORN guidelines, communicating the potential delay to the surgical team and exploring options for managing the schedule. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for surgical instruments with the absolute imperative of patient safety, which is paramount in sterile processing. The operating room nurse must exercise careful judgment to ensure that all sterilization protocols are strictly adhered to, even under pressure. The cost-benefit analysis mentioned in the question highlights the tension between resource allocation and risk mitigation. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established sterilization guidelines, which are legally mandated and ethically binding. The Association of Perioperative Registered Nurses, AORN guidelines for perioperative practice, which are the standard of care in the United States for CNOR certification, provide detailed protocols for sterilization. Following these guidelines ensures that instruments are rendered safe for patient use, preventing surgical site infections and other complications. This aligns with the core ethical principles of beneficence and non-maleficence. An incorrect approach that bypasses or shortens validated sterilization cycles is professionally unacceptable due to specific regulatory and ethical failures. Such actions directly violate the AORN guidelines and potentially federal regulations, e.g., those enforced by the FDA regarding medical device reprocessing. Ethically, it breaches the duty of care owed to the patient and demonstrates a disregard for established safety standards. It also undermines the integrity of the sterile processing department and the entire surgical team. Another incorrect approach that relies on visual inspection alone for sterility is also a failure. While visual inspection is a component of the process, it is insufficient to guarantee the absence of microorganisms, especially in lumens or complex instruments. Sterilization is a validated process that requires specific parameters time, temperature, pressure, chemical concentration to be met. The professional decision-making process for similar situations should involve a systematic risk assessment. This includes identifying potential hazards, e.g., microbial contamination, evaluating the likelihood and severity of harm, and implementing control measures. In this context, the control measure is strict adherence to validated sterilization protocols. When faced with time constraints or resource limitations, the professional must advocate for the necessary resources or explore alternative solutions that do not compromise patient safety, such as utilizing backup instrument sets or rescheduling non-urgent procedures. Communication with the surgical team and sterile processing leadership is crucial to address systemic issues that lead to such pressure. Question 17. Operational review demonstrates a need to enhance the safe and effective application of electrosurgical devices in the operating room. Which of the following approaches best addresses this need by integrating patient safety, technological understanding, and procedural best practices? Option A. Relying primarily on the surgeon's extensive experience with electrosurgical devices, assuming their judgment will inherently ensure safe and effective application without the need for additional standardized checks. Option B. Prioritizing rapid procedure completion by minimizing time spent on electrosurgical device setup, calibration, and safety checks, focusing solely on achieving hemostasis and tissue cutting. Option C. Implementing a standardized protocol that includes preoperative equipment checks, selection of appropriate energy modalities and power settings based on tissue type and surgical objective, meticulous attention to grounding techniques, and ongoing intraoperative monitoring of device function and patient response. Option D. Utilizing a one-size-fits-all approach to electrosurgical device settings, assuming that generic parameters are suitable for all procedures and tissue types, regardless of the specific device model. The correct answer is C. Implementing a standardized protocol that includes preoperative equipment checks, selection of appropriate energy modalities and power settings based on tissue type and surgical objective, meticulous attention to grounding techniques, and ongoing intraoperative monitoring of device function and patient response. Explanation. Scenario analysis. This scenario presents a common challenge in the operating room where the effective and safe application of electrosurgical devices is paramount. The challenge lies in balancing the need for efficient tissue management and hemostasis with the potential for unintended thermal injury to surrounding tissues, vital structures, and the patient's overall safety. Ensuring proper device function, appropriate energy setting, and correct technique requires a deep understanding of the technology and its potential complications, demanding meticulous attention to detail and adherence to established protocols. Correct approach analysis. The correct approach emphasizes a comprehensive, multifaceted strategy that integrates preoperative planning, intraoperative monitoring, and postoperative evaluation. This aligns with the core principles of patient safety and quality care mandated by regulatory bodies overseeing surgical practice. Specifically, it reflects a commitment to evidence-based practice, continuous learning, and proactive risk management. The emphasis on understanding the specific electrosurgical device's capabilities and limitations, selecting appropriate energy modalities and power settings based on tissue type and surgical objective, and employing proper grounding techniques directly addresses the potential for thermal injury and ensures optimal therapeutic outcomes while minimizing adverse events. This approach is supported by guidelines from professional organizations focused on surgical safety and perioperative nursing, which advocate for a thorough understanding and application of advanced surgical technologies. Incorrect approaches analysis. One incorrect approach focuses solely on the surgeon's experience without incorporating standardized safety checks or device-specific protocols. This fails to acknowledge that even experienced surgeons can benefit from and are expected to adhere to established safety measures, especially with evolving technology. Regulatory frameworks and best practice guidelines emphasize a team approach to patient safety, where all members of the surgical team are responsible for identifying and mitigating risks. Relying solely on individual expertise without systematic verification increases the likelihood of errors and overlooks potential device malfunction or user-specific misapplications. Another incorrect approach prioritizes speed and efficiency over meticulous technique and safety checks. While efficiency is desirable in the OR, it must never compromise patient safety. This approach disregards the critical importance of proper grounding, insulation integrity checks, and appropriate energy delivery, all of which are fundamental to preventing unintended burns, fires, and other serious complications. Regulatory bodies and accreditation standards explicitly mandate adherence to safety protocols designed to prevent such adverse events, making this approach a direct violation of patient care standards. A third incorrect approach involves assuming all electrosurgical devices function identically and can be used with generic settings. This overlooks the significant variations in technology, power output, waveform characteristics, and safety features among different electrosurgical units and accessories. Regulatory guidelines and manufacturer instructions for use, IFU, stress the importance of understanding the specific device being used. Failure to do so can lead to suboptimal performance, increased risk of complications, and potential noncompliance with safety standards. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the patient's condition and the planned surgical procedure. This should be followed by a comprehensive review of the available electrosurgical equipment, including its specific capabilities, limitations, and manufacturer's instructions. A critical step involves a preoperative assessment of the equipment, ensuring all components are functional and properly connected. During the procedure, continuous vigilance regarding energy settings, tissue response, and the integrity of the electrosurgical circuit is essential. Post-operatively, a review of patient outcomes and any perioperative events can inform future practice and identify areas for improvement. This iterative process, grounded in safety protocols and evidence-based practice, ensures the optimal and safest application of electrosurgical devices. Question 18. The assessment process reveals a patient scheduled for a total knee arthroplasty has significant preoperative muscle atrophy in the quadriceps and hamstrings, coupled with a history of multiple falls due to poor balance. Which of the following nursing considerations best addresses the implications of this musculoskeletal status for the surgical procedure and recovery? Option A. Documenting the patient's muscle atrophy and history of falls in the medical record and proceeding with standard surgical protocols for knee arthroplasty. Option B. Focusing solely on the immediate surgical site preparation and ensuring sterile technique is maintained throughout the operation. Option C. Implementing specialized positioning techniques to protect the affected limb, collaborating with physical therapy for preoperative strengthening exercises, and planning for enhanced postoperative pain management and mobility assistance. Option D. Relying on the surgical team to manage all aspects of the patient's musculoskeletal limitations during the procedure and recovery. The correct answer is C. Implementing specialized positioning techniques to protect the affected limb, collaborating with physical therapy for preoperative strengthening exercises, and planning for enhanced postoperative pain management and mobility assistance. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient responses to surgical interventions affecting the musculoskeletal system. The perioperative nurse must integrate a broad understanding of anatomical structures, physiological processes, and potential complications with the specific needs and pre-existing conditions of each patient. The implication for surgery is significant, as compromised musculoskeletal integrity can impact positioning, surgical approach, recovery, and long-term functional outcomes. The challenge lies in anticipating and mitigating risks associated with these implications, ensuring patient safety and optimal care within the established regulatory framework for operating room nursing. Correct approach analysis. The correct approach emphasizes a comprehensive, patient-centered assessment that directly informs the nursing care plan. This aligns with the core principles of perioperative nursing practice as outlined by professional organizations and regulatory bodies governing nursing practice in the United States. Specifically, it reflects the standards of care that mandate thorough preoperative assessment, identification of potential risks, and the development of individualized interventions. This approach ensures that the nurse is actively engaged in risk management, advocating for the patient, and preparing the surgical environment and team for potential challenges related to the patient's musculoskeletal status. This proactive stance is crucial for preventing adverse events and promoting positive surgical outcomes, adhering to the ethical obligation of beneficence and non-maleficence. Incorrect approaches analysis. An approach that focuses solely on the immediate surgical procedure without considering the broader implications of the patient's musculoskeletal system, fails to meet the standard of comprehensive perioperative care. This oversight could lead to inadequate patient positioning, increased risk of injury during the procedure, or delayed recovery. It represents a failure to adhere to the nursing process, which requires holistic patient assessment. Another incorrect approach might involve relying on generalized protocols without tailoring them to the individual patient's specific musculoskeletal condition. While protocols provide a baseline, musculoskeletal issues are highly individualized. A failure to adapt care based on specific findings, such as joint instability or muscle atrophy, could result in suboptimal care and potential harm, violating the principle of individualized patient care. A third incorrect approach could be to delegate the assessment and management of musculoskeletal implications entirely to other members of the surgical team without active nursing involvement. While collaboration is essential, the perioperative nurse has a distinct responsibility for patient assessment and care planning within their scope of practice. Abdicating this responsibility could lead to gaps in care and a failure to advocate for the patient's unique needs. Professional reasoning. Professionals should approach such situations by initiating a systematic and thorough preoperative assessment. This involves reviewing the patient's medical history, including any previous musculoskeletal injuries or conditions, and conducting a focused physical assessment relevant to the planned surgery. The nurse should then synthesize this information to identify potential risks and complications related to the patient's musculoskeletal system. This identification should directly inform the development of the nursing care plan, including strategies for patient positioning, intraoperative monitoring, and postoperative care. Collaboration with the surgeon and other members of the healthcare team is crucial to ensure a unified approach to managing identified risks. Continuous evaluation of the patient's status throughout the perioperative period allows for timely adjustments to the care plan, promoting patient safety and optimal outcomes. Question 19. Consider a scenario where a patient undergoing a lengthy abdominal surgery experiences a progressive decrease in urine output, accompanied by a rise in serum creatinine and blood urea nitrogen (BUN) levels. The surgical team is focused on meticulous dissection, and the anesthesiologist is managing anesthetic depth and hemodynamics. As the certified nurse, operating room (CNOR), what is the most appropriate immediate action based on the physiological implications of these findings? Option A. Continue to monitor the patient closely, assuming the decreased urine output is a temporary side effect of the anesthetic agents being used. Option B. Focus solely on the surgical field and wait for the surgeon to complete the procedure before addressing the patient's laboratory values. Option C. Document the laboratory values and decreased urine output in the patient's chart and wait for the anesthesiologist to initiate a discussion about renal function. Option D. Immediately alert the surgeon and anesthesiologist to the patient's declining renal function and advocate for a comprehensive assessment of potential causes, including hypoperfusion and nephrotoxicity. The correct answer is D. Immediately alert the surgeon and anesthesiologist to the patient's declining renal function and advocate for a comprehensive assessment of potential causes, including hypoperfusion and nephrotoxicity. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for rapid physiological decompensation in a patient undergoing a complex surgical procedure. The operating room nurse must possess a profound understanding of the interplay between surgical manipulation, anesthetic agents, and the patient's underlying organ system physiology to anticipate and respond effectively to emergent situations. Failure to recognize subtle physiological shifts can lead to delayed interventions, exacerbating patient compromise and potentially impacting surgical outcomes. The CNOR role demands not just technical skill, but also advanced critical thinking rooted in physiological principles. Correct approach analysis. The correct approach involves recognizing that the patient's decreased urine output, coupled with a rising serum creatinine and BUN, strongly suggests acute kidney injury, AKI. This is a critical physiological response to potential hypoperfusion or direct nephrotoxicity. The CNOR responsibility, guided by established perioperative nursing standards and evidence-based practice, is to immediately alert the surgical and anesthesia teams. This allows for prompt assessment of hemodynamic stability, fluid balance, and potential etiologies, e.g., intraoperative hypotension, blood loss, nephrotoxic agents. Early recognition and intervention are paramount in mitigating the severity of AKI and preventing further organ damage, aligning with the core principles of patient safety and quality care, mandated by professional nursing practice guidelines. Incorrect approaches analysis. Attributing the decreased urine output solely to anesthetic agents without further investigation fails to acknowledge the broader physiological implications of AKI. Anesthetics can influence renal blood flow, but a significant drop in output with rising creatinine points to a more systemic issue requiring immediate medical evaluation, not just a passive observation. Ignoring the rising laboratory values and focusing only on the surgical field overlooks critical systemic indicators of patient distress. This approach violates the ethical obligation to monitor the patient holistically and the professional standard of care to integrate all available data for patient assessment. Waiting for the surgeon to complete the procedure before addressing the physiological changes is a direct contravention of the CNOR responsibility to advocate for the patient's immediate well-being and to intervene proactively in the face of deteriorating physiological status. Professional reasoning. In such situations, the CNOR should employ a systematic approach. 1. Continuous patient monitoring. Vigilantly observe vital signs, fluid balance input/output, and laboratory trends. 2. Data integration. Synthesize all available data, including surgical field observations, anesthetic effects, and laboratory results. 3. Early communication. Promptly and clearly communicate any significant deviations from baseline or expected physiological parameters to the surgeon and anesthesiologist. 4. Collaborative problem solving. Participate in the collaborative assessment of the patient's condition and contribute to the development of an intervention plan. 5. Documentation. Accurately and thoroughly document all observations, communications, and interventions. This decision-making process prioritizes patient safety, adheres to professional standards of care, and ensures timely, evidence-based interventions. Question 20. The investigation demonstrates a CNOR evaluating patient positioning options for a lengthy posterior spinal fusion. Which of the following approaches best aligns with current best practices for ensuring patient safety and optimal surgical outcomes in this scenario? Option A. Utilizing a standard prone position with minimal padding, relying on the surgeon's experience to manage potential pressure points. Option B. Placing the patient in a lateral decubitus position to facilitate easier surgical access, assuming this position is generally safe for spinal procedures. Option C. Positioning the patient in a prone position and proceeding with the surgery without additional padding, as the surgical table is designed to support the patient's weight. Option D. Implementing a multidisciplinary approach involving preoperative patient assessment, collaborative planning with the surgical and anesthesia teams, and the use of specialized positioning devices with meticulous padding and regular intraoperative neurovascular checks. Correct answer is A. Utilizing a standard prone position with minimal padding, relying on the surgeon's experience to manage potential pressure points. Explanation. The investigation demonstrates a scenario where a certified nurse, operating room CNOR, must evaluate different patient positioning strategies for a complex orthopedic procedure. This scenario is professionally challenging because improper patient positioning can lead to significant patient harm, including nerve damage, pressure injuries, vascular compromise, and respiratory compromise. The CNOR responsibility extends beyond simply placing the patient. It involves a comprehensive understanding of anatomical risks, surgical site access requirements, and the patient's individual physiological status. Careful judgment is required to balance surgical needs with patient safety, ensuring all potential complications are mitigated. The correct approach represents best professional practice because it prioritizes a multidisciplinary, evidence-based strategy. This involves preoperative assessment of the patient's skin integrity, mobility, and any pre-existing conditions that might be exacerbated by positioning. It necessitates collaboration with the surgeon to understand the specific surgical approach and instrumentation required, and with the anesthesia provider to monitor physiological status throughout the procedure. The use of specialized positioning devices, appropriate padding, and regular intraoperative checks for pressure points and neurovascular status are all critical components of safe positioning, aligning with established perioperative nursing standards and guidelines that emphasize patient advocacy and risk management. Incorrect approaches fail to meet professional standards by neglecting crucial aspects of patient safety and collaborative care. One incorrect approach might involve relying solely on the surgeon's directive without independent nursing assessment or consideration of potential patient-specific risks, which violates the nurse's ethical duty to advocate for the patient and can lead to deviations from best practice guidelines for pressure injury prevention and nerve protection. Another incorrect approach could be the failure to utilize appropriate padding or positioning aids, increasing the risk of tissue damage and nerve compression, directly contravening established protocols for safe patient handling and positioning. A third incorrect approach might be the omission of regular intraoperative checks of the patient's position and skin integrity, which is a critical nursing responsibility for early detection and intervention of potential complications, thereby failing to uphold the standard of vigilant patient monitoring. Professional reasoning in such situations should follow a systematic process. First, thoroughly assess the patient's individual needs and risks. Second, collaborate with the surgical and anesthesia teams to understand the procedure's requirements and potential physiological impacts. Third, select and implement evidence-based positioning techniques and equipment. And fourth, continuously monitor the patient for any signs of compromise, adjusting positioning as necessary throughout the surgical procedure. This iterative process ensures that patient safety remains paramount while facilitating optimal surgical access.